Welcome to the show Talk with Your Doc. With me is Dr. Harshad Telang. He is a surgeon at Thunder Bay Regional Health Science Center, and we are talking about the colorectal cancer. Thank you so much, Dr. Telang, for enlightening us about the various causes of colorectal cancer and why the colorectal cancer is increasing in our society. Please tell us, what is the initial disease before it becomes the cancer in the colon?
So the colon usually goes through a transformation from normal tissue to polyp to cancer, and what we try to do is we want to find it at that stage before it becomes cancer and deal with it at
early
the polyp
stage diagnosis, right?
Exactly.
So polyp stage is the early stage of the cancer, which is like a
Yes.
curable stage of cancer probably. But
Yes.
what are the different types of, like when you send us, like as a surgeon, you send us the polyps, and we get some good polyps and few bad polyps. Good polyps, we call it as hyperplastic polyp, and the so-called bad polyp, we call it as adenomatous polyp. So please tell us about what are the chances of different polyps becoming cancer.
So hyperplastic polyps have pretty much zero chance of turning into cancer, and so if we find those, we get them checked, and if somebody like yourself tells us that that's what they are, then we don't worry about it. The adenomatous polyps have precancer type potential, and so it all depends on the type of polyp and the size of the polyp as to their cancer potential. But any adenomatous polyps we want to remove.
Remove completely. So how do you remove those polyps? What procedure do you do to get the polyps out of the colon?
So there's two ways to remove a polyp. One is by colonoscopy, and then two is by surgery. So if at all possible, we try to take it out with a colonoscope, so that way it avoids an operation. So what a colonoscope involves is it's a very long tube which gets advanced up the colon, and with it we can visualize the entire colon and part of the small bowel if necessary, and if we find any polyps we can take them out with instruments that we can advance through the colonoscope.
So colonoscopy is a procedure by which you can examine the GI tract, and if there is any bumps or lumps you take a biopsy, or if there is a polyp you take out and send it to our pathology lab.
Yes.
Now, how often one should get this colonoscopy done?
So the interval and the age at which it should be done vary depending on patient factors. So if you're a member of the general public without any history of colon cancer in the family and no worrisome symptoms or anything, then you should have your first colonoscopy after the age of 50, because we know that the incidence of polyps rises.
So no family history, first colonoscopy at the age 50. Okay.
And then if you do have a family member with colon cancer, like we discussed, then you should have your colonoscopy either at the age of 50 or earlier if it's within 10 years or more from the age of diagnosis. So for example, if your mother was diagnosed with colon cancer at age 55, then you should have it at 45.
Okay. So 50 years of age, I don't have a family history of colorectal cancer. I get my first colonoscopy done and everything is normal. When do I come back for the next colonoscopy?
10 years.
Okay, every 10 years.
Yes, until age about 75. After 75, there's no need to do any further screening colonoscopies. It's different for symptoms, but for pure screening purposes, there's really no benefit.
So 50 years and then every 10 years. And if the family history of colorectal cancer, then first before the 10 years of diagnosis of the family with the colorectal cancer, and then how often we come back?
Every 5 years.
Every 5 years. So
Yes.
it is more frequent than the normal population.
Yes. And then there's one other incident, or one other patient population that we also are interested in doing screening colonoscopies, and those are firefighters.
Firefighters.
So firefighters have an increased risk of developing colorectal cancer
really?
because of their work exposure to carcinogens.
Wow.
And the recommendation is that they should have their first colonoscopy after about 20 years on the job, and then every 5 years or so after that.
So there's occupational exposure hazard
yes.
to them. Right. Now, this colonoscopy can help us to diagnose polyps or diagnose the cancer at early stage. what are the other tests we can do to diagnose colorectal cancer at the early stage? What are the other investigations or laboratory tests can be done?
So there's a couple of different tests. So with regards to looking at the colon itself, if you don't want to do a colonoscopy, there's two other avenues. There's a barium enema and a CT colonography.
Oh.
Both of them are radiologic tests which look at the bowel through imaging. But if anything is found, a colonoscopy has to be done because they can't do any treatments.
Okay.
Other tests as pure screening tests for general populations are stool testing for fecal occult blood, the FOBT test, which is what's available right now. But as of next fall, there's a new test which will be the FIT test.
What is FIT test?
It tests for actual immunohistochemistry, and so it's much more accurate at finding polyps in the colon.
So in that, do we have to do biopsies, or how do we do that FIT test?
The FIT test is similar to FOBT. It's still a stool sample,
test. Okay.
but it's just one rather than three. And if it comes back as positive, then you move on to a colonoscopy.
Okay. So first investigation is colonoscopy. If somebody doesn't want to do, then you do barium enema or CT guided colonoscopic procedure, and the other is stool positive test, guaiac stool test.
Well, the stool testing should be done by everybody over age 50 every couple of years.
Okay.
And then if it's positive, then colonoscopy should be done. But for general populations to do a colonoscopy, that should be, as long as it's normal, every 10 years, but the stool testing should still be done every 2 or 3 years.
Now in the stool test, what do we detect exactly? Like, is that blood in the stool we are detecting, right?
Yes.
So who gets this blood positive in the stool?
Well, with the new test that's coming out next year, it's much more specific for colon polyps.
Okay.
The test that's available now can be positive from any source of blood.
Any source of blood, right? So this new test, FIT test, will differentiate between the bleed due to colorectal cancer and that due to other diseases?
Yes.
Okay, that's good. So anybody over the age of 50 should get stool testing for blood every 2 years, colonoscopy after 50 years, every 10 years, and any other test other than this you recommend?
No.
No, that's it, right?
Yes.
Okay, so after this screening, if the biopsy is positive, then what do you do?
So if it comes back as a cancer, and it all depends on what the
type
specimen.
of cancer it is.
Yes. So if it's just a polyp and the cancer is contained in the polyp, we get the report that says that the stalk is clear. So if you imagine like a mushroom with the cancer in the top and then the base of it is clear, then typically we don't need to do anything other than more frequent colonoscopies.
Follow, right.
But if there's concern that the entire polyp is cancer, or if you see an actual cancer, then the next step is operation.
Thank you so much. We'll take a quick break and we'll come back. Thank you.